Hi, my name is Sarah Young, and I'm excited to talk to you today about areas that make me a strong candidate for the program, creating a culture of wellness, and 2 attributes that make someone a great occupational therapy clinician. Over the past year and a half, I've had the opportunity to shadow in 3 different OT settings. My first one was at Endurance Rehabilitation and Wellness Center PC in East Brunswick, New Jersey. There I shadowed for a total of 24 hours under Doug Cleek, who specializes in neurology and orthopedic upper extremity disorders. During my time there, I got to watch as he treated his patients while also teaching and testing me on my knowledge of the muscles and the bones. I also helped by applying ice and heat to the patient's injuries. I also sometimes would follow along with the exercises that they were doing to get a better understanding of what it was that they were doing and what it is that I will be doing as a future occupational therapist. Then a few months later, I did an internship at Tampa General Rehabilitation Hospital in Tampa, Florida. There, I shadowed for a total of 40 hours where I got to observe under multiple OTs and some PTs as well. There, I got to see many different types of injuries, such as patients who may have suffered from a stroke, or they broke their leg, or maybe they suffered from a really bad fall at home. Then a few weeks later, I got to have an internship at Grow and Play Pediatric Therapy, Inc. in Tampa, Florida. There, I shadowed for a total of 40.25 hours under Katie Pantillo, Claire McCabe, and Rihanna Durant. It's a pediatric outpatient clinic where I got to see children varying from ages 2 to 16 with many different types of disorders, such as autism spectrum disorder, Down syndrome, cerebral palsy, ADHD, and then there were also some kids there for school prep. Out of the 3 shadowing experiences that I got to have, that was my favorite. I loved getting to hang out with the children and getting to see them have fun thinking that this was playtime or maybe a little extra tutoring time, when in reality they were getting help on their fine motor skills, some of them getting help on their pencil grip skills, or overall maybe just learning how to be able to stay calm in scenarios. I had a lot of fun at that internship. During my time at the University of Tampa, I also took a few courses that really helped deepen my interest in OT and helped broaden my horizon and education on the profession as a whole. My applied kinesiology course helped taught me about all the different types of muscles and which muscles correlate with which movements. I earned a 97.38% in that course. My human development across the lifespan and my human development and motor learning courses were very helpful in teaching me how the mind and body coincide with each other. I received a 93% in my human development and motor learning course, and then I received an 88% in my human development across the lifespan course. I also took a course called Arts and Health, which I found to be a very cool course, and while it wasn't directly correlated with OT, like with my major, I found it to be a very cool class as I got to learn about all the different ways that I can take art and take my creative side and just utilize it as a tool to help treat my patients in OT. I received a 100% in that course. I feel that as a future occupational therapy practitioner, I can create a culture of wellness by helping my patients create healthy daily habits and build their independence. These things can really help benefit not only the physical challenges, but also the mental challenges. For an example, creating routines for children with special needs or developmental delays. These routines would consist of sensory-involved activities such as brushing, steamroller, or the body sock. Then I would have the child complete their homework. I would also involve lots of tactics that would be helpful in having the child calm down as they may get overwhelmed in situations. I also think it is very important to properly educate the parents on how to properly enforce these routines at home on a daily basis. I believe that 2 attributes that would make someone a great occupational therapy clinician is the ability to adapt to situations and the ability to be creative. The ability to adapt to situations is important as an OT because things are always changing and your plans to treat a patient may not take the original path that was intended for the day. I learned this through my time shadowing multiple different OTs. The ability to be creative is also very important as an OT because creativity is key when it comes to problem solving in this profession, and it is also very important when it comes to creating a treatment plan. If you can't be creative as an OT, you won't be able to work to your highest potential. Thank you for your time. I hope to see you soon.